Okay, hi Ken, it's Dr. Buford. We're just getting started on the left knee. We're looking in the medial compartment. This is the anterior horn of the medial meniscus. It looks good here in the front. Nice smooth edge. You can see the meniscocapsular junction here. Vascularity, you can see how it kind of stops at the outer rim of the meniscus. We want to track this all the way posterior. I examined your knee before we started, and I was encouraged actually by the stability. You had a little bit of instability, but one of the other tests that we do was actually pretty good. And so we're having a look inside the knee first because I promised you we wouldn't commit you to anything without confirming it. Here's the posterior horn of this medial meniscus. And as we hook this and lift it up, turn on my outflow just a little bit, just for a second, turn this on. Let me just create a little bit of flow here. That meniscus actually looks pretty good. Now, the articular surface on the tibial plateau here looks pretty good here. And on the femoral condyle up above also looks pretty good. You can see the kind of normal amount of consistency here, sponginess, if you will. Now we're going to look in the central part of the knee, and this is where I was hoping to see good news. We're going to take the shaver here and get rid of this ligamentum, which is this structure right here. This is not the ACL. Now we can see the ACL a little bit better. This is the ACL back here. So we'll take that probe back in just a minute here. Hold the camera here. Scalpel. Okay, so here's the ACL in the middle of the knee. The tibial origin down here looks pretty good. I'm not sure quite yet what's going on over here. You can see some torn tissue here. That might be important in a minute. But as we look back up here in the central part of the knee, this ACL normally inserts on the lateral wall back up in this region here. And usually with a significant ACL injury, we can pull this away from the wall, or actually it's just torn. And other than some vascularity on the sheath here, I'd be hard-pressed to reconstruct that. Now you've got something interesting here where the PCL inserts. But again, nothing that's a surgical problem, but this is just a little bit of synovial tissue over the PCL insertion. And then we've got this torn tissue here, which for the most part looks like it's going to be lateral meniscus. So we're going to go off on the video, look at this lateral meniscus next. Okay, so here's the lateral compartment. We can see some lateral meniscal tearing, and maybe that was part of the symptom generating pathology here. That area that I wasn't sure about, this is a little bit of torn tissue, but it doesn't look like it's ACL. You can see ACL to the left. It doesn't appear particularly loose. It's really right at the origin of the lateral meniscus there at the root. But again, it doesn't appear to be in a weight-bearing part of the knee, and it's pretty easily dealt with like that. So I'm going to take a biter and just smooth out this inner edge. You can see us work here. This tear is in a part of the meniscus that really doesn't get a great blood supply, and that's why we're just going to trim out this little portion, and that's why we're not doing a repair. Now, if we have some better biters, that would be significantly appreciated. We'll get some better biters in just a second here. Okay, so here we've trimmed that meniscus. You can see we've taken out a very small portion of it, but enough of that loose flap that hopefully it'll make a difference, and it won't propagate, maybe more importantly. So I'm happy with the way that lateral compartment looks now. See the popliteus tendon back behind the meniscus there, that looks good. The articular surfaces here looking pretty good. We're going to look in the patellofemoral area in just a minute. This is your kneecap or your patella at the top of the screen. You can see a little bit of softness in the cartilage right here. Again, anything that's really loose I can usually take care of pretty quickly by turning the suction on this shaver. But the good news here is I don't see much in the way of arthritis. Now we're going to look at the trochlea before we make a final comment on it. Trochlea is this area here, all the way down to the front of the knee, and that cartilage looks pretty good. So I'll tell you what, I think we're going to save you a big reconstruction today. You've got a little bit of a plica up north. We'll talk about that in a minute. But I think we can save you an ACL reconstruction and still get you better by doing this limited menisectomy. You can see a little bit of the plica here that we're going to try and release. Sometimes they grow back, but we'll get you moving pretty quickly, so hopefully that won't happen. Let me see, since we have the cautery, let me see it. And now that suprapatellar pouch is open. Okay, so this will be the end of the video. I really hope this does the trick for you. Goodbye now.